Government spending plan that would eliminate all funding for Obamacare. It's now in the sticky, sweaty hands of Harry Reid. Meantime, the president claims House Republicans are just trying to mess with him over Obamacare. Obama says Obamacare will not be stopped. His colleague, Congresswoman Nancy Pelosi, is calling House Republicans legislative arsonists who want government to shut down.
I was making the distinction between those who say, how much government do we need, to those who say, we don't need any government. The anti-government ideology that is making a mess of what goes on in Congress now.
Do you think there will be a government shutdown, or is there room in there for some sort of agreement that could bring enough Democrats and enough Republicans in the House together to keep the government in business at the end of the month?
Let's be really clear about this. The Republicans put a legislation on the floor that was intended to shut down government. For them, that's a victory, because they're anti-government ideologues who dominate the Republican Party.
They wanted to defund Obamacare.
No, they want to shut down government. The effect of putting the Affordable Care Act on the bill is to shut down government.
Conservatives in the Senate are doing everything they can to round up the votes needed to pass the bill. That would mean a handful of Democrats agreeing to defrock Obama's signature legislation. Can it be done? Joining me now, private medicine advocate and Obamacare expert Patricia Newman. I guess that's the key question. Can it be done? And as we noted, it can only be done, that is, defund Obamacare and pass in the Senate, if the Democrats go along with the Republican bill.
Right, and I think the important thing is, you know, right now what Ted Cruz and Mike Lee want to do is to not allow Reid have a cloture vote, which will limit the debate of the bill, and it also, you know, if it passes, allows them to only have 50 votes to get rid of to put the funding back in.
Right.
So if we can, you know, stand together, all the Republicans stand together and not allow the cloture vote, at least that gives us time. And I think time is really important for the voters right now, because it was because of them that this happened in the House to begin with.
Right.
You know, that it was a pressure from the voter, and I think the more time we have to work on our senators, the better it is for the outcome.
And we're also looking at a possible filibuster to actually block a vote so that doesn't happen. And it would be kind of ironic, because Cruz or Rubio or Rand Paul would be filibustering the very thing that they want to have pass. But of course, they want it to pass in its entirety. They want it to pass to strip out Obamacare, in spite of what the former House Speaker said, who's slightly off kilter, I think, a little bit, Nancy Pelosi, that these folks don't want to shut down government. They want to defund Obamacare. The thing that kills me in this whole thing, though, Patty, is that they could have done this 2 years ago, a year ago. Now we're waiting until the 11th hour, after the tentacles of Obamacare have latched on the different various aspects of our society and our medical and health system, that it's really scary that we're waiting until the last minute like this.
I know. We have 8 more days till, you know, open enrollment begins. And, you know, if you think about it, it's bad that Congress in general waits so long to decide on these things. It's also bad the insurance companies themselves wait till the government puts so much pressure on them to finally come up with some kind of market idea. You know, the exchanges, for example, the private exchanges, where, okay, we'll put everybody together, you can go and shop for your insurance there. But everybody waits till the last minute, and I think the voters are pretty, you know, sick of it. I think one of the symptoms of it, at least in the House, there were 10 Democrats that didn't vote. You know, they abstained from voting on the House resolution, on the CR. And I think they're afraid. They're afraid of what's going to happen to them come 2014. I think it's really telling. You know? Well,
there's a majority of Americans who do not want Obamacare. Poll after poll after poll. From the beginning, before this thing was even passed, when it was passed, now it's been very steady. Around 53% do not want Obamacare. But let's talk about the exchanges.
Right.
Those begin, as you mentioned, on October 1st. And there's only a few states, I don't know, it's like 15 or so, that actually set up their own exchanges. And the rest of the exchanges have to be set up by the federal government. And from what I'm hearing is that the numbers, the choices just aren't there. Like, for example, California, the largest, most populous state, the choices in the exchange is relatively small versus the open market.
That's right. I mean, because the insurance companies want to wait. They're sitting it out. They don't want to participate. They don't know what this is going to do to their bottom line. You got to remember, part of the Obamacare limits the amount of money the insurance companies can make, and having to deal with all the regulations and the limit on them making money, it makes them think, well, you know, I sit it out and see what happens to the rest of them that want to play. But the other problem that's happening too is the software. The software the federal government is supposed to use to sign up everybody. Turns out that the calculations are not right, and people cannot figure out what kind of policy premium, assistance they're going to get, or what their ultimate premium is going to be, because the software doesn't know how to add and subtract the right numbers. So people are telling, they're going to have to go back to the state the state numbers, and then come back after they figure out what is their amount of subsidy. It's ridiculous.
But the bottom line is, even if they can get their adding and subtracting correct here, and maybe use the old method with a pencil, rates overall are going to be going up for most Americans. That's the bottom line here, because the only way Obamacare works is if the healthy subsidize the not so healthy.
And the healthy are not likely to sign up. There was a study by ADP of the healthy young population, and historically, even if they have the opportunity to sign up, even if their premiums are cheap, because they're young and they're healthy, they still don't participate. And with the $95, get out of jail card they're getting, there's no reason for them to participate. So premiums will go up. Everybody that's sick will be in there. And
well, we'll see how it plays out on Capitol Hill. We'll find out very, very soon. Patty, thank you.
Thank you.
Coming up next, the president and his version of the debt ceiling debate as the Daily Ledger continues.